Hello everyone, welcome to the channel. My name is Ify. Today we are going to be talking about titers, medicals, and documents you need to provide prior to your acceptance into the clinical term, which should be your second term if you are spending 2.5 years. Remember that if you come into the program with all of your prereqs, you will have only 2.5 years to go. So your first term, which is 6 months long, is going to be your pre-nursing term. In your pre-nursing term, you will have 4 courses to complete if you're spending 2.5 years, for example. You will have critical thinking, foundation of nursing, nutrition, dosage calculation, and pharmacology. Dosage calculation and pharmacology, they merge together to make one course. So these 4 courses are the courses you will take in your first term. After your first 6 months, if you successfully pass all of these courses, you will then move into the actual nursing program, which would be the term where you will go for your first lab. You will also go for your first clinical rotation. But before they accept you into that portion of the program, there are things that you need to fulfill before they are able to let you go into that portion of the program. I'm going to list that out for you real quick. So you will need your BLS certification. You will need to show that you've taken your flu shot, COVID vaccine, measles, mumps, and rubella. You will need to show that you have immunity for all of this: varicella, hepatitis B, tuberculosis, Tdap. You need physical exam conducted by your healthcare provider. You will also need to show health insurance. You need your health insurance card. You will need your healthcare provider to fill out an attestation form for you. You will also need to do your drug screening. Now, once you do all of this, you will, after passing all your 4 courses in your pre-nursing term, obviously, they will send you an official letter telling you, hey, you've been accepted into the actual nursing portion. But if you don't have any of this, you will not be able to go and attend your first clinical rotation. You will be able to do your lab. Remember that in your lab, you're going to be dealing with mannequins, not patients. You're not touching blood. So you are good to go. You will go for your lab. You can continue working on your courses. The ones you do online, you can do all of that, but you are not able to go and do your first clinical. So now that you've been accepted into the program, this is a good time to start gathering all of your documents. This is a good time to start looking into all of that and know how to go about it, especially with the hepatitis B. You know, it takes about 7 to 8 months to get everything completed. For example, if you take your first shot this month, you will need to wait another month or even more. I think, between 1 month to get your second shot. After taking your second shot, you will have to wait 5 months to get the third one. After taking the third one, you will have another month to go and test to see if you have built immunity. So it takes a while to do all of that, and you don't want anything that will delay you or cause any kind of stress for you when it's time to go for your clinical. So it's good to do your calculation now. We can actually do it together. So 6 months, your first term. Once you go into your second term, the next month, let's say you start your second term in January. By February, you will go for your first lab. 2 months after that, you will go and do your first clinical. So add everything together and know exactly when to start gathering all those documents. Like your BLS, you need to be certified every 2 years. So for things like that, I would advise you wait till like almost the end of your first term to get that done. Your things like your flu shot, you can wait to almost the end of your term to do your flu shot. Your drug screening, I would advise to also wait to almost the end of your term to do that. The reason why I'm saying this is because they expire. Some of them 1 year, some 2 years. So it will make sense. You just started the program this month and you're already doing all of that. So it's good to wait so that by the time it expires in 12 months or 24 months, whatever the case is, you would have advanced into the program, because you're going to pay for everything all over again. It's not going to be free. So whatever you paid to do it the first time, you will still pay to get it done. So that's why I'm saying for some, you may need to wait to almost the end of your term to get them done. But for your Hep B, if you don't have any, this is a good time to start. Do the calculation, check the time, and know exactly when to start taking your doses and all of that, so that you won't encounter any problem when it's time to go for your clinical rotation. This is what I'm here to talk about today. If you have any question, if you have any comments, if you've gone through this, if you are currently going through this, you can leave your comments below or questions. I'll respond to them as quickly as possible. Thank you for watching. Enjoy the rest of your day. If you haven't subscribed, subscribe. Bye.